Dr. Asela Gunawardana, Director General Health Services, our chief guest for the day. Sir, the stage is on for you to address the gathering.
Good morning to all of you. The President of Sri Lanka Association for Child Development and the past presidents and all the council members and all the presidents of the colleges, professional colleges, and presidents of the Government Medical Officers Association. I can see Darshan is there, Dr. Darshana, and all the DDGs, all the directors from the Ministry of Health, and all the professors, all the consultants, and all the dignitaries from the foreign faculties, and all the other dignitaries who are present here. It's an honor actually to present here and addressing you all, and I am thankful to Dr. Gayatri and all the council for inviting me for this occasion. And before I start my speech, I think as a ministry and as a nation, there is ample things to be done in this field. So I am thankful for all of you to taking this initiative and starting this work. As a DGHS, I pledge that my fullest support to improve this service and do something for these children who are really in need. And my second thing is now we are training community pediatricians and posting them to the community. So I think here the GMOA president here and all the other college presidents are here. So this is my personal view. So are we going and taking their capacity fullest for treating these children? So you have to think twice whether we are going to keep them at teaching hospitals downwards and take the fullest capacity and treat these children, or are we going to keep them at the periphery where they don't have facilities actually, because they don't have physiotherapists, they don't have speech therapists, right? So these things, I think, with the current economic crisis, we'll have to do changes. We'll have to start changes. So this is the food for thought. This is my personal view, not the ministry's view. Don't put anything on that my ministry's view. Otherwise, Darshana and myself will be again in a problem. So this is, I think there are ample things to be done to these needy children, right? And even the disabled people in this country. So it is worldwide, but as Sri Lankans, I think we should start somewhere. This is the right time to start these things. So it is an honor to have been invited to attend the 6th Biennial Scientific Congress of Sri Lanka Association of Child Development, the first multidisciplinary professional organization in Sri Lanka which works relentlessly towards the welfare of developmentally challenged children in the country, their families and their communities. The collaborative efforts of multi-healthcare professionals, doctors, physiotherapists, occupational therapists, speech and language therapists, orthotists, educational psychologists, while taking into account the contributions of Sri Lanka College of Pediatricians, Prenatal Society of Sri Lanka, Ceylon College of Psychiatrists, Ceylon College of Sri Lanka College of Child and Adolescent Psychiatrists, Sri Lanka Medical Associations, and Sri Lanka Association of Speech and Language Therapists are focused upon, as the organization rightfully says, to uplift all the children to bloom to their full potential, and it's fine example of the feats we can achieve collectively in the best interest of all the people in this country, if only we are to work together in unity and harmony. WHO and the World Bank estimate that more than 1 billion people live with some form of disability, which equates approximately 15% of the world's population. Among these, 110 to 190 million, about 2 to 3.8% adults have very significant difficulties in functioning. There are currently no reliable and representative estimates based on actual measurements of the number of children with disabilities in Sri Lanka. Existing prevalence estimates of childhood disability vary considerably because of differences in definitions and the wide range of methodologies and measurements instruments adopted. The limitations of census and general household surveys to capture childhood disability, the absence of registries in most low and middle income countries, and poor access to culturally appropriated clinical and diagnostic service contribute to low estimates. As a result, many children with disabilities may neither be identified nor received needed service. WHO states in its discussion paper on early childhood development and disability that young children with disabilities are often overlooked in mainstream programs and services designed to ensure child development. They also do not receive the specific support required to meet their rights and needs. Children with disabilities and their families are confronted by barriers including inadequate legislation, policies, negative attitudes, inadequate services, and lack of accessible environments. If children with development delays or disabilities and their families are not provided with timely and appropriate early intervention, support, and protection, their difficulties can become more severe, often leading to lifetime consequences, increased poverty, and profound exclusion. Convention on the Right of Child, CRC, and the Convention on Right of Person with Disabilities, CRPD, highlight how children with disabilities have the same right as the other children. For example, to healthcare, nutrition, education, social inclusion, and protection from violence and abuse and neglect. Children who experience disability early in life can be disproportionately exposed to risk factors such as poverty, stigma, discrimination, poor caregiver interaction, institutionalization, violence, abuse, and neglect, and limited access to programs and services, all of which can have a significant effect on their survival and development. Poverty may increase the likelihood of disability and may also be a consequence of disability. Children with disabilities and their families are more likely to experience economic and social disadvantage than those without disability. Children with disabilities are among the world's most stigmatized and excluded children. Limited knowledge about disability and related negative attitudes can result in the marginalization of children with disabilities within the families, schools, and communities. The quality of child-caregiver interaction may be compromised when a child has a disability. High support needs can place considerable stress on caregivers. Children with disabilities are more vulnerable to physical, sexual, and psychological abuse and exploitation than non-disabled children. Social isolation, powerlessness, stigma faced by the children with disabilities make them vulnerable to violence, exploitation, and in their own homes and in other environments such as care centers or institutions. Ensuring access to appropriate support such as early childhood intervention is ECI, and education can fulfill the right of children with disabilities, promoting rich and fulfilling childhoods and preparing them for full and meaningful participation in adulthood. All children with disabilities have the right to develop to maximum extent possible. Children with disabilities who received good care and development opportunities during early childhood are more likely to become healthy and productive adults. This can potentially reduce the future cost of education, medical care, and other social spending. The following areas for action have been identified to ensure that the rights and needs of young children with disabilities and their families are met. Inclusion of children with disabilities in mainstream policies, systems, and services which support and maximize their development potential. Programs and services which specifically target young children with disabilities and their families. Involvement of children with disabilities and their families in all early childhood development activities, including policy development, service design, and program monitoring. Capacity development of human resource across relevant sectors to address disability. Public awareness and understanding about children with disabilities, data collection and research. With these areas of action in mind, let me take a moment to appreciate the innovative work this professional organization has achieved over the course of the past 2 years. Annually, SLACD celebrates World's Down Syndrome Day, World's Autism Day, and World's Children's Day with programs and workshops to educate professionals as well as the public in Sri Lanka, as Dr. Gayatri has already mentioned. In 2021, during the COVID pandemic, SLACD organized a virtual children's program day themed Little Heroes Lockdown Diaries that received more than 700 talented videos which were webcast via YouTube, and every child was given a certificate to appreciate their talents. In 2022, SLCD made a constructive use of popular television media platforms to conduct awareness program on autism, organize SLCD Jaffna Knowledge Sharing Program, which we have already seen. SLCD regularly works with International Academics of Alliances of Childhood Disabilities, that is IACD, to share and update knowledge and skills of professionals in Sri Lanka. I noticed that scientific conference this year is going to explore further into autism spectrum disorders and other development disorders, cerebral palsy, muscle disease, spinal dyspharism, and moving on from there to mental health issues in adolescents, challenges experienced in classrooms, and finally towards addressing concerns that have overarched through the time. I sincerely hope that the deliberation made during the proceedings of these 2 days would help set the stage to bring about timely interventions and reforms that are much needed in the context of economic crisis that Sri Lanka is facing at present. On that note, I would like to conclude my address by extending my best wishes for your organization for all in its future endeavors. I wish all of you a very pleasant day. Thank you.
දරුවා එකම දේ නැවත නැවත කිරීම, සෙල්ලම් බඩු එක දිගට තැබීම, ඕටිසම් තත්ත්වයේ ලක්ෂණයක් විය හැකි. ඕටිසම් ලදරුවියේදීම හඳුනාගතහොත් හොඳින් පාලනය කළ හැකි. නොපමා වමතන්න 117 SLACD සහ CDB සාමූහික මෙහෙවරක්.
If your child focuses on things in a repetitive or obsessive way, it could be a sign of autism. Autism can be successfully managed if identified at an early age. Call our helpline on 0117490000, a joint effort by the SLACD and CDB.
குழந்தை மீண்டும் மீண்டும் ஒரே செயலை செய்தல், விளையாட்டுப் பொருட்களை ஒரே வரிசையாக அடுக்குதல் ஓட்டிசத்தின் அறிகுறியாக இருக்கலாம். ஓட்டிசத்தை சிறு வயதிலேயே இனங்கண்டு கொண்டால் அதனை கட்டுப்படுத்தலாம். தாமதியாது அழையுங்கள் 0117 490 0000. இது SLACD மற்றும் CDB இணைந்து செயற்திட்டம்.